Welcome to the Radiology Scholars High Yield Concepts in Radiology video on the shoulder MRI. In this video, we're going to start off by discussing the shoulder anatomy on MRI. So before we get started, I just want to talk about the anatomy in the anterior and the posterior view. So the four major muscles go by the acronym SITS, the four major rotator cuff muscles. So S for supraspinatus, I for infraspinatus, T for teres minor, and S for subscapularis. And notice how the subscapularis is viewed on the anterior side, and the other three are viewed on the posterior side. So they come around here and attach at the greater tuberosity, and then the subscapularis attaches at the lesser tuberosity at the head of the humerus. And then we can see the bones here, the acromion right over here, the clavicle, the coracoid process, the AC joint, and then the head of the humerus noted right over here. So it's really important to kind of understand these basic rotator cuff anatomy before we move into the MRI. Okay, so this is just a picture of the planes. This is a little bit different for the shoulder because the coronal and the sagittal are in oblique orientation, although it's kind of helpful to get a gist of how the planes look like. So the axial is the one that cuts perpendicular to the body, and then the coronal goes in this manner, and the sagittal is perpendicular to the coronal, although both of these orientations are oblique, so we'll talk about that in a minute. Okay, so this schematic is a little bit more helpful in understanding coronal oblique and sagittal oblique. So this is the right shoulder, and this is an axial image overall. Again, axial is cut perpendicular to the body, and we're looking at the right shoulder, while this structure up here being more superior, and this is more inferior structure to the shoulder. So kind of imagine the patient being supine, and then the slices are cut perpendicularly, and this is kind of the image that we would see. Now, the sagittal oblique cuts the slices in this orientation, and the coronal oblique cuts in perpendicular manner. So it's a little bit different than the traditional sagittal and coronal, since we're going at a more 45-degree angle and we're more oblique. Although it can be easy to kind of remember that they're perpendicular to each other, so that might be helpful in understanding their orientation. Okay, and kind of putting all of these things together, so the axial orientation, again, perpendicular to the body. Usually in the axial sequence, we go from superior to inferior or vice versa, kind of work our way up and down the shoulder. This is the more lateral side, and again, we're looking at the right shoulder. So this is the lateral to the body, this is more medial, this is more anterior, and this is more posterior. So coronal oblique, the slices are cut in this direction. And this is the image that it would generate. And usually in the coronal oblique, we go from either posterior to anterior or vice versa, because this is the more anterior side, this is the most posterior side. And if the slices are cut in this direction, then you'd kind of be moving back and forth in that manner. And then for oblique sagittal, this is kind of the image that you would generate. This is perpendicular to the coronal oblique, and the slices are cut in this direction. And usually it's either medial to lateral or vice versa, because again, we're cutting these slices in this direction, and this is a more medial structure, and these are more lateral structures. So it's important to put these things together before we kind of get a better understanding of the orientation. It can be a little bit tricky, although moving kind of up and down, in and out, in like an actual sequence, it becomes easier to identify these structures. Okay, and this is the axial sequence. We're kind of working our way from more superior to inferior. So this is the right shoulder. The first thing we notice is the AC joint, because we're at the very top. This is the acromion, and this is the clavicle. And now we've kind of worked our way to be more inferior. And again, this is the more anterior side, and this is the posterior side. So this muscle right over here is the subscapularis on the anterior aspect, and this is the head of the deltoid. And one of the other structures to look for is along head of the bicep tendon. So this is kind of where it attaches right over here. And then this over here, this kind of triangular area, is the superior labrum. And then the triangular area down here is the inferior labrum. So again, more inferior structures, and this is more superior structures. And then the subscapularis on the anterior aspect. And this is the glenoid and the humeral head. So this is the glenohumeral joint area. And we're going to work our way downwards from here. Okay, and now we're even more inferior. We still notice on the anterior side the subscapularis right here. And then the posterior side, we notice the infraspinatus and the teres minor. So again, this is the posterior aspect, this is the more anterior aspect. We worked our way from more superior to inferior structures in the axial sequence, which kind of cuts perpendicularly. And this is the right shoulder that we're looking at. Okay, this is coronal oblique view. This is an axial image to kind of see the orientation. So this is similar to the schematic that I talked about earlier. The slices are being cut in this direction, and it's perpendicular to the oblique sagittal view, which we'll eventually talk about. So again, this is the right shoulder, and the images are being cut in this manner and then projected over here. Okay, and we're going to work our way from more posterior to anterior structures. So in the posterior aspect, we have the infraspinatus, which is predominantly noted. Okay, and now we're a little bit more anterior. So we start to notice the AC joint, the acromion right here, and then the clavicle. Right underneath that, we notice the supraspinatus muscle kind of going in, and then the tendon attaching on this side. And then the subscapularis is becoming more visible up here. One of the things to look for is a superior and inferior labrum. So the superior labrum is right over here, the small triangular area, and then that down here is the inferior labrum. Okay, and now we're even a bit more anterior, so all of this is the subscapularis. It's becoming more prominent. Up here, the supraspinatus is still visible. We still see the clavicle up here. One of the other things to look for is the long head of the bicep tendon, which is right over here, kind of goes here. And so in this coronal oblique orientation, we worked our way from more posterior to anterior, and some of the structures we noted were the rotator cuff muscles, the AC joint, the long head of the bicep tendon, and the superior and inferior labrum. Okay, and lastly, this is the sagittal oblique view, this is the axial orientation. We can see how the slices are being cut in this manner. This is perpendicular to the coronal oblique view, which we saw earlier, where the slices are being cut in this manner. So it's perpendicular to this white line. And again, these are more anterior structures, and these are the posterior structures. This view is a little bit similar to the plain film Y view. So if you can kind of imagine that, it might make it a little bit easier. So this would be the clavicle up here. This would be the scapula, the coracoid process, and then the acromion. Okay, and now we're moving a little bit more laterally. So again, that's the anterior side and then the posterior side. So the muscle that's on the anterior aspect is the subscapularis, just right over here. And again, this is the coracoid process, the supraspinatus up here. This will be the infraspinatus, and then the teres minor kind of down here. This is the clavicle, and this is the acromion. And now we're going a bit more laterally. We notice the AC joint, the clavicle right over here, and then the acromion. We see the head of the humerus more prominently now since we were shifting more laterally. And again, these are the rotator cuff muscles here, and then the subscapularis on the anterior side. Okay, and now we moved a little bit more lateral. One of the structures to look for is the long head of the bicep tendon, which is kind of right over here. It attaches here and then kind of works its way around here. So again, we went from more medial to lateral, this side being the anterior aspect and this is the posterior aspect. I hope this video was helpful in kind of just getting the basics of orientation down. It can be a little bit confusing, especially given these single images, although it's really helpful to just figure out the orientation before you kind of get more into understanding the pathologies of the shoulder MRI. Thank you guys for watching.